I think there have been a number of changes in the last few years in breast cancer treatment. Once you know you have the disease, firstly is really integrating care, because it's very, very important to recognize that not just surgery alone in many cases, or medical treatment alone, or radiation alone is the optimal tool. But in fact, it's not only the combination of them all, but it's how they're combined. In surgery, there have been many advances. Certainly nowadays, only a minority of women need to lose their entire breast in the management of breast cancer. And those who do, usually it's because of disease that occurs in many different locations in the breast or is in a critical anatomic position. So breast conservation is now the standard. Increasingly, of course, saving lymph nodes has become a standard as well, as we've incorporated sentinel lymph node evaluation into the standard treatment of breast cancer so that we only remove 1 or 2 or 3 lymph nodes instead of removing an entire packet of lymph nodes as we used to do. But of course, even within the breast itself, surgical techniques have improved. And now, surgical oncologists, like myself, utilize tools called oncoplastic surgery, in which not only do we remove a segment of the breast, but we move tissue within the breast to fill in defects and gaps in order to preserve the appearance of the breast. Within treatment itself, one of the ways that we have made dramatic advances is to think about targeting therapy, using the right therapy for the right patient. And this involves 2 approaches. One is not to treat patients who are already likely to be cured by local treatment alone, or by a very, very simple systemic treatment like hormonal changes. And the second is to identify those patients who need more aggressive therapies and to pick the right therapy for those individuals.